Good day, my name is Lydia Holmes, and this is my presentation on facts on drugs for the City of New York. New York City's current climate with drug abuse and reduction strategies. New York City is currently facing a severe drug abuse crisis, particularly related to opioids and fentanyl. New York City Mayor Adams today released the administration plan for applying $50 million in funding annually by fiscal year by 2027 to combat the opioid addiction crisis New Yorkers continue to face. Drug overdoses deaths in New York City reached a historic level in 2021, with 2,668 overdose deaths recorded, a 27% increase from 2020 and a 78% increase from 2019. Fentanyl was detected in 80% of drug overdoses deaths in New York City in 2021. What is fentanyl? Medical News Today states that fentanyl is an opioid pain reliever for use in medical treatment. Although healthcare professionals consider fentanyl safe and effective when a person uses it in a monitored medical setting, the drug carries a high potential for misuse, also known as abuse. What are opioids? NIDA states that opioids are a class of drugs that include synthetic opioids such as fentanyl, pain relievers available legally by prescription such as oxycodone, hydrocodone, codeine, morphine, the legal drug heroin, and many others. Or in combination with other drugs is a major driver of the drug overdose crisis in the United States. The vast majority of overdose deaths in recent years involves illicitly manufactured fentanyl and other poignant synthetic opioids which to be added to other drugs and consumed unknowingly. Demographic trends. Racial and geographic disparities in overdose deaths widened in 2021. Black New Yorkers had the highest rates of overdose deaths for the second year in a row, more than doubling from 24 per 100,000 in 2019 to 53.5 1,000 in 2021. The Bronx had the highest rate of overdose deaths, particularly in neighborhoods like Hunts Point, Mount Haven, Tremont, and High Bridge. Adult ages 55 through 64 and residents of high poverty neighborhoods also experienced high rates and large increase in overdose deaths. Harm reduction strategies. New York opened 2 overdose prevention centers, OPCSs, in November 2021, the first government-sanctioned sites in the United States. From opening through the end of 2022, the OPCSs were used over 52,000 times by 2,227 unique individuals. Staffs at OPSs intervened in more than 670 overdoses to prevent potential injury or death. The city is expanding access to naloxone, fentanyl test strips, and other harm reduction supplies. Treatment and services. New York City aims to reduce overdose deaths by 15% by 2025 through various initiatives. New York City has expanded hours and services at overdose prevention centers. Efforts are underway to increase access to medication-assisted treatments and other evidence-based interventions. Government response. The city is working on expanding response plans to address the crisis. In the first 9 months of 2022, the city increased distribution of naloxone kits and fentanyl test strips. The health department is committed to a place-based, equality-centered strategies to reduce overdose deaths. In my closing statements, New York City's drug abuse crisis demands urgent action. While the situation is crucial with record overdose deaths and widening disparities, the city's multifaceted approach offers hope. Innovative strategies like overdose prevention centers and expand harm reduction efforts are saving lives. However, challenges persist. Moving forward, we must remain committed to evidence based solutions, community support, compassionate care. By working together, we can turn the tide to this epidemic, creating a safer and healthier New York for all. Every life saved brings us closer to overcoming this crisis and building a more resilient city.